everyone, I'm Paige Abbott, registered psychologist in the province of Alberta. I tell clients all the time to name the pain. What's the rationale behind that? How come I tell people to do that? And what benefits does it serve? That's what I'm going to explore in today's video. Before I do that, I just want to give a quick disclaimer that self-help videos like this are not a substitute for professional assessment and diagnosis, but they can be a very helpful tool in your self-development journey. So naming the pain. Some of you have probably heard and come across this idea already. It actually stems out of narrative therapy, which when I learned about it in university, to be honest, my initial thought was, oh, this is interesting. It taps into the stories that our brain holds about our lives, our symptoms, which I do believe in very much. And it's very language-based. So how do we talk to ourselves about ourselves, our life, the world? So I found it really interesting, but to be honest, I thought, I don't really know if this is going to have much value as a practical therapeutic tool. Of course, fast forward to, I don't even know when that was that I took an introduction to narrative therapy, probably would have been at least 15 years ago. So fast forward to the present day, and lo and behold, I find that some of these narrative therapy tools are some of my most tried and true, most effective and favorite tools to use in the counseling environment. There's so much power in the language that we use and the stories that we carry. And I now am able to blend this intellectual knowledge with following my intuition to be able to pick out when I'm hearing clients talk about these stories. And I do believe that sometimes these stories come out of that unhealthy part of the brain. So it's almost like there's this ongoing tussle in our minds between the base mammalian reward circuitry of our brain, which is very primal, very primitive, controls our basic drives for food and sex, and the higher order kind of frontal lobe parts of our brain. So that's our abstract thinking. A lot of people refer to this frontal part of our brain as really what makes us human. It gives us the capacity to think and engage with the world in a very different way than the other species that we cohabit the planet with. So there's this ongoing tussle. Sometimes this base reward mammalian part of the brain, it's just very simplistic in its drives and in its desires. It wants survival, it wants the quick and easy way, it wants the pain-free way, it wants the easy fix, and it wants that shot of dopamine to tell it when to do more of something, which usually comes when experiences are more intense, chaotic, dramatic, painful. So there's this part of the brain that's operating, and there's this higher order part of the brain. And a lot of those stories I find are taken from that mammalian drive, and this higher order part of our brain makes a story out of it. And the stories, they're quite interesting, they're quite fascinating. Some of them can be quite humorous because they're really so bizarre when you truly listen to them, but people do believe them tried and true. I guess a few ones that come to mind, a more common one is people who are trying to move away from one problematic substance or behavior and have this narrative or this story going that using another substance or engaging in another unhealthy or unhelpful behavior is what's going to help them move away from that. So using, cocaine to help with eating or body issues, things like that, which when you hear it in that story, it makes a lot of sense to the brain. Seems to be a good blend between the higher order goals and the mammalian part of the brain. But really when we out that and when we look at it, it's quite bizarre in what that story is saying. We do also carry stories about ourselves, where we come from, and so it's important as a part of therapeutic practice that you learn to start to listen to these different parts of your brain. So there are going to be certain stories that come from that reward mammalian part of the brain, which again is looking for some pretty specific things. Dopamine, quick fix, easy way, escape, relief, reward. And the higher order thinking part of the brain, which I tend to view more as the authentic self. I like to set up that dynamic that there's the healthy and authentic part of self, which is more rooted up here, but also more importantly in here, kind of in that deeper level of our soul, our intuition, which we could get into a long philosophical discussion about, is that different than this? I'll leave that for you to figure out your own beliefs and views on. But there's all of those factors operating, and then there's also that base mammalian part of the brain. So what are we doing when we're naming the pain? Essentially what we're doing is we are trying to give name and ownership and acknowledgement to this guy, that base mammalian reward-driven part of the brain. That's the part of the brain that I believe, because I see it all the time, creates the main challenges that people struggle with. Mental health symptoms, depression, anxiety, trouble with relationships, trouble with substances, trouble with behaviors, trouble with feelings. It creates all sorts of complications in life. It's important that people name this, because if you don't name it, what people tend to do is personalize the symptoms and the experience. And now these symptoms, which are pretty icky, they're pretty unhelpful, they're pretty gross, quite frankly, now people are attaching those to their personality. That's a big problem. I don't want people to be identifying their personhood and their personality by their symptoms. So naming the pain, some people give it the more kind of clinical name. So it's my eating disorder, it's my addiction, it's my depression, it's my anxiety, it's my whatever people have been comfortable with accepting in terms of diagnoses over the years. If that's the name for your pain, great, own it. Other people, they like to give it a literal name, so a person's name or just any kind of label that they can attach to it. I've also heard people refer to it as the inner roommate, the inner jerk. Some people kind of take that more religious approach. It's the devil part of the brain. For other people, it's the gremlin, the inner rogue agent who just kind of goes off and does its own thing. I've heard lots of different names over the years. Those are just a few. You don't have to pick any of those. I want you to find something that's very personal for you. And once you've named the pain, then the journey becomes starting to identify, how does that part of the brain think? How does it prompt you to feel? How does it prompt you to behave? What's it on the hunt for, and how does it accomplish that? Now, people really have a solid foundation on which to build their health and their recovery plan. They're no longer identifying this part of the brain as part of their personhood or personality. They recognize that it's part of them, it exists within their brain, but it doesn't define their personality and their personhood. You are an individual person who has your own traits, qualities, characteristics, strengths, and vulnerabilities. You are not a set of symptoms that's been created by genetics and experience and exposure. Much like someone would not say, I am cancer or I am diabetes. They would say, I have cancer, I have diabetes. People with these conditions are much better at naming the pain. My pain is the cancer. My pain is the chronic ailment that I'm struggling with. These are the symptoms. These are the ways that it leads me to act and react and engage with the world. And yet with mental health, we're quite a few steps behind. We're used to lumping it all together as the person. And that makes treatment and change very difficult because people are so entrenched in their shame that they can't see past that. So, from my perspective, naming the pain is one of the most significant action steps that you can do in your journey of recovery and improving your overall mental health and well-being. It's the starting point to really starting to look at these symptoms you're experiencing as just that, symptoms, rather than a part of you and your personality. So I would encourage you to take some time to think about what kind of name would be comfortable for you at this point. And then you might want to do some writing and some tracking to get to know how does that part of your brain lead you to think. What sorts of things does it throw out? What are the sort of feelings that it capitalizes on or festers? What are the behaviors that it likes and looks for, and anything else that you can identify to get to know that cluster of symptoms? And then you might also want to do some writing about the authentic part of self, you. Who are you? How do you think? What do you believe? What do you value? How do you want and like to behave? What's important to you? What matters most to you? That's you. Unfortunately, sometimes that can be overshadowed and very muted by this unhealthy part of the brain. But with awareness and with action, it's more than possible to have that louder, rogue agent, unhealthy part of the brain start to be put into perspective. So I think that that's amazing work that you can do for yourself, and I really hope that you'll give yourself that gift. Thank you so much for tuning in and watching this episode on Go Grow Yourself. I appreciate all of your support. Any comments, any feedback, any future topics that you'd like to see me talk about, please do comment below. I would love to hear from you. Take care and all the best to you.